Who should be cautious when drinking matcha? Heart disease. Matcha contains a high level of caffeine, which can be equal to or exceed the amount found in a cup of coffee. For individuals with heart conditions like high blood pressure, arrhythmia, or coronary artery disease, caffeine may trigger an increased heart rate, palpitations, or sudden spikes in blood pressure. Patients with these conditions should consult their doctor for advice on caffeine-free alternatives, such as herbal teas. Anxiety disorders and insomnia. The caffeine in matcha stimulates the central nervous system. Individuals with chronic insomnia or anxiety disorders may find that matcha exacerbates their symptoms. For those sensitive to caffeine, it is best to avoid drinking matcha in the evening or eliminate it from the diet altogether. Taking blood thinners. Like other green teas, matcha is rich in vitamin K, which can interfere with the effectiveness of blood thinners, such as warfarin. A sudden increase in vitamin K intake may reduce the effectiveness of these medications, increasing the risk of blood clot formation and potentially leading to serious complications like stroke or heart attack. Patients on blood thinners should maintain a consistent vitamin K intake and consult their doctor before consuming matcha. Pregnant and breastfeeding women. Excessive caffeine intake during pregnancy can raise the risk of miscarriage, premature birth, or low birth weight. Pregnant women should limit their caffeine consumption to under 300 mg per day, with 1 cup of matcha containing between 60 to 80 mg of caffeine, depending on how it is prepared. Matcha also contains catechins, which may reduce the absorption of folic acid, an essential nutrient during pregnancy. Pregnant and breastfeeding women should consult their doctor before drinking matcha regularly, especially if they are taking folic acid or iron supplements. Digestive disorders and stomach ulcers. Like coffee, the caffeine in matcha stimulates stomach acid production, which can lead to nausea, acid reflux, or even stomach pain. Individuals with conditions like gastritis, irritable bowel syndrome, or gastroesophageal reflux disease should be cautious when consuming matcha. Additionally, the tannins in matcha can interfere with the absorption of non-heme iron from plant-based foods, which may result in anemia if consumed frequently without proper dietary management. Nutritionist Lon advises against drinking matcha on an empty stomach, as it may irritate the stomach lining. Children. According to the American Academy of Pediatrics, children over the age of 12 should limit caffeine consumption to no more than 85 to 100 mg per day. Children under 12 should avoid caffeine, including matcha. For older children, caffeine intake should be kept